When the journey of healthcare is long, the path to a brighter future is often hindered. That's why today we, Code Red Lifeline, a dedicated team of 6 ALX students, are uniting our efforts to bring hope closer to the homes and hearts of those affected by sickle cell disease in Kenya, particularly in lakeside counties of Kenya like Kisumu, Homabay, and Siaya. As part of the ALX Global Challenges and Opportunities project, we are committed to making a tangible and lasting difference, addressing the stigma and lack of care that threaten the futures of the 14,000 Kenyans who are born with sickle cell disease annually. Now, Achieng, a 28-year-old mother from Homabay, whose child was diagnosed late because there was no community awareness campaign or nearby screening center, her story represents thousands of similar cases in the lakeside counties, and our solution is built with people like Achieng in mind, individuals who need timely, accessible health support. In Kenya, particularly in Kisumu, Siaya, and Homabay counties, sickle cell disease remains one of the silent causes of childhood mortality and poor quality of life. The problem is worsened by late diagnosis, lack of awareness, and limited access to proper healthcare services. We believe that with the right intervention, lives can be saved and futures secured. Critical gaps in sickle cell disease awareness and management in the Lake Region counties. Starting with general awareness. Only 63% of the respondents had ever heard about sickle cell disease. Shockingly, 37% had no awareness at all. When we looked at sources of information, most people learned about SCD from schools and neighbors, but only 9% cited health workers as their sources. This highlights a missed opportunity within the healthcare settings to educate communities. Misconception and widespread. While 55% correctly understood that SCD is inherited, a worrying 39% either didn't know the cause or believed wrong theories like poor sanitation or infection. Knowledge on diagnosis is low. Only half of the respondents knew SCD is diagnosed through a blood test. The rest were either unsure or believed it could be detected through urine or stools. Testing rates remain critically low. Just 1.2% of those we surveyed had ever been tested for sickle cell disease, despite high community exposure. Exposure versus the action gap. Interestingly, 59% knew someone living with SCD, but personally testing and proactive health-seeking behaviors were rare. Confusion about curability. Only 26% believed SCD is curable, while 39% simply didn't know, exposing serious gaps in knowledge around the disease's nature. Positive note on prevention. Over 52% of respondents believe SCD can be prevented, a hopeful sign that preventive education could work. Incredible community willingness. Finally, A very promising 99% of respondents supported newborn screening for sickle cell disease. This shows an open door for early intervention strategies. These findings are not only validated our concerns but also shaped our solution to create a digital kiosk platform that empowers community with accurate information, encourages early diagnosis, and bridges the healthcare gap. And some of the biggest challenges we uncovered include delayed intervention, myths and stigma surrounding sickle cell disease, poor health literacy, lack of early screening, weak data tracking, and limited access to support system. These pain points deeply inform the solution we are about to introduce. After exploring solutions options, our proposed solution is to set up a digital community kiosk within communities that will offer digital awareness campaigns, affordable early screening, real-time support, and crucial data collection. The kiosks will be mobile accessible and human-supported, making them inclusive and accessible even in underserved areas. Now here is why we chose the digital kiosks. Because they are cost-effective, scalable, and community-centered approach. They combine health education, early detection, and reliable data management, directly addressing the biggest gaps we observed. By leveraging technology, we offer not just treatment, but hope as well. On our wireframe and prototype review, here is a preliminary design. Our wireframe focuses on simplicity, accessibility, and relevance to the user journey. Every feature has been designed with the user in mind. Easy navigation, multilingual options, and a clean health support interface. We managed to gather feedback from our target community. For example, Derek, an 18-year-old boy who has been battling sickle cell disease since birth. They expressed excitement about the ability to access screening close to home, get real-time health information, and be connected to doctors without traveling long distances. Their feedback reaffirmed that this solution can genuinely meet a felt need. Our KPI for the next 3 months is as follows. We aim to achieve 3 major milestones: conduct 500 plus early screening tests, reach 1,000 plus community members with sickle cell education, and collect actionable data from at least 3 major counties to inform further intervention. However, we recognize potential concerns such as safeguarding users' personal health data, and to mitigate this, strict privacy protocols and community sensitization programs will be enforced. We are also mindful that our solution's success depends on consistent community engagement and reliable internet access. Now, to our viewers, to bring this vision to life, We are seeking funding to build and deploy the first pilot of our digital kiosks across Kisumu, Homabay, and Siaya counties. The funding will support 3 key areas. First, the technical development of the kiosk and app. Second, the community sensitization campaigns to drive engagement and awareness. And third, initial operational costs, including training local health workers to run the kiosks effectively. With the right investments, we can dramatically reduce delayed diagnosis, boost early intervention, and transform healthcare literacy around sickle cell disease in some of Kenya's most vulnerable communities. Imagine a Kenya where a child's health is not determined by their postal code. Together, we can make early detection and quality healthcare a right, not a privilege. Thank you for listening, for believing in hope, and for investing in futures.